Hello and welcome to Health Matters on Channels Television. It's great to have you join us. I am Mary Alale Yusuf. It's 50 years since the first case of Lassa fever was discovered in Nigeria. Since then, there have been outbreaks every year in parts of the country. Data shows that cases usually spike during the dry season, although these days we don't know what's happening with the pattern. The worst outbreak was in 2018, killing up to 171 people before subsiding. By January this year, there were 60 confirmed cases in 7 states and the Federal Capital Territory. As at today, confirmed cases are 136. Now, based on the increase in the number of cases, the Nigeria Center for Disease Control, NCDC, has officially declared it an outbreak. My guest is a public health physician and the General Secretary of the Lagos chapter of the Association of Public Health Physicians, APHPN, Dr. Doyin Ogunyemi. You're welcome to the show.
Thank you for having me.
Okay, so we thought last year was the worst, but this year is looking like it has the potential. In fact, already it's looking like it's the worst year so far. But we heard about a lot of preparations, a lot of stuff that was being done against Lassa fever last year. Why are we being taken by storm? By this shock of, of an outbreak?
It's not only dependent on the person, so we still have climatic factors.
Okay, so you're saying that global warming is somehow affecting this?
So the fact that we still have the seasons when the rats, these kinds of rats, the multi-mammate rats, breed a lot. And when they breed, they have up to 20, rats. And so as long as we still have that cycle going on, they would still be there. That is not to say that they necessarily have to cause harm, but it's to say that the environmental factors are still there. So we the host, we have the agent, we have the environment. And so as long as there's still a link between the three.
The interaction.
The interaction. But if we're able to break that chain, either by protecting the host more, or by protecting the environment more, or by dealing with the rats itself, then we would have it better.
Okay, we hear of rapid response teams.
Mm-hmm.
Can you enlighten us? What is in a rapid response team?
So that's you have rapid response teams when there are outbreaks. People who can immediately respond to an emergency. So maybe go to cases, evacuate cases, take them to treatment centers, mobilize materials, drugs, supplies, testings, ensure that people who have already been infected are quickly attended to so that they do not die. Remember that it's a virus. The incubation period is 6 to 21 days.
Okay.
And if you're able to start treatment within 6 days of that infection.
Okay, 6 days is the window.
The chances are better.
Okay.
The chances are far better.
So a person can be treated after 6 days, but the chances are not as good as before 6 days.
Sure.
But there's still the hope after 6 days.
Sure, there is.
Okay. I want to ask you this. When should a person begin to feel suspicious? Because it's like the response starts from the patient.
So if it's difficult because like most viral illnesses, they mimic, to give you symptoms that are very generalized. So fever, malaise, feeling unwell, some pain here and there. So the person would usually present when it continues. So again, the first thinking in our area is to think that it's malaria fever.
That's right.
Which is okay, but at the same time is to have a high index of suspicion. So if I immediately start, I should immediately test you first and foremost. And that's why I want to encourage treatment after diagnosis. So we have rapid diagnostic kits for malaria, and I think that we should use it at all facilities. Okay. We should stop just treating with assumption. So if somebody presents to you, please, at least use the rapid diagnostic. If it is negative, then you may want to suspect that could it be something else apart from malaria, and then you should take immediate steps.
Okay. Apart from malaria being eliminated, are there other febrile illnesses that can be eliminated, to narrow down the diagnosis for Lassa fever?
Well, people may also think that they're having typhoid fever. And so you can also do testing for that is not that easy. It's not a one-off test. Okay. So I would say that it's better to, approach it like, could this be? And then we now find out it is not, rather than try to wait out other kinds of diseases, especially now that we know that there's
So once they've done the rapid diagnostic test, found out it's not malaria, then they should begin to suspect Lassa fever.
Suspect Lassa fever, especially when, for instance, we know the states that are being affected, and people move from here to here. So you take a history, and then you begin to suspect. Maybe the person has had contact with somebody who was also ill and had to care for that person. So that's why it's good to ask some of these questions. So you then take samples, and of course you have channels to submit such samples, get across to the state, to the epidemiology center, where they can take the samples to Luth, where they can actually check and diagnose. So have a high index of suspicion. Please act fast. You never know.
Okay, so the admonition now is to act fast.
Yes.
I know that there's a lot of responsibility on the side of the patient. The person has to act fast, go to the hospital, get tested for malaria, eliminate that, and then begin to suspect. If that is negative, let's begin to look at Lassa fever and other things. Lassa fever, probably because it's endemic in our area. So you will not be thought foolish, right? To be thinking, maybe I have Lassa fever. Let me go check. But here's where I'm going. I believe that in this country, people tend to want to sit out a fever. And, it's not so bad. Let's just wait and see. And then by doing that, they're losing time. Are there fevers that just you wait out and they go?
Well, most viral fevers, you can wait it out. So if I'm having upper respiratory tract infection, and because of that, I'm having a bit of fever, it will go, But that is not necessarily to encourage such. Again, it comes back to, you said most times we sit back things. It takes me back to, and not wanting to go off, is the fact that every time you think of going to the hospital and you remember that you probably have to put your hand in your pocket and bring out some money to pay for this and pay for that, then you hold back. And that's why in many developed countries where the insurance system is very well taken care of, you just submit yourself. After all, it's been paid for. And most people who already have such services also find it a little easier to go to the facilities, just to be sure that it's not something else.
Okay, so talking of facilities now, let's leave the money first. But talking of facilities, let's say somebody is running a high temperature and they suspect maybe the parent wants to act fast. Where exactly should the person go? Should it be a general hospital? Should it be the primary healthcare center? Where? Because at such a time, you'll find out that most people don't even know where to go.
So you can go to the primary health center, because the primary health center is linked to the secondary health center, is linked to the tertiary health center. So ideally, even at that primary health center, they have an officer who is able to at least say, this is the problem, and call the next person. And they're all linked to the local government. They're all linked to the epidemiological team. So I think I would encourage people to still go to the primary health center. Okay, but we also find from research that a lot of people, about 60% of people, would first go to a private hospital.
Okay.
And that's fine if that is where they are already linked to. And even if they go there, also everybody working in such facilities should be prepared in this season. Lassa fever, there's an outbreak. And so you begin to ask questions along those lines. It's not everybody that comes to you that has Lassa fever.
Definitely not.
But then you can ask questions that can let you have that suspicion. But please ask those questions. That is what we're saying. please have precautionary measures. Please know the next line, know the hotline to call, know who to call, know the next steps. And even private facilities are not eliminated from reporting. Every facility is supposed to report anything that is suspicious, so that next steps something. And they should take precautions, because from the news, the health worker was affected.
Yes, one health worker has been affected now.
So we've had more rodent human beings affected, which tells you that at the community level, we're still having a lot of issues with the environment, because you can either have rodent to human or human to human. You know, and it's an accident if it's rodent to human and then human to human continues, then you know that the hospitals or the health centers are the issues. But when it's more rodent to human, then it shows that it's still at that community level. We need to do a lot of awareness, advocacy, education, up the hygiene, and so on and so forth. But then if a health worker has been affected, we then should also
be looking at the human to human factor, right?
Although human to human can still be relatives taking care of another relatives, but much more a health worker trying to take care of a patient. And so the issue of infection prevention control materials, are those supplies there? Because what you should be wearing when you're taking care of someone who's suspicious is not just gloves. It's the entire face mask, it's the entire gown, sterilized. You must use these things and throw away. You must ensure that things that must be reused are well sterilized, well managed. Needles, sharps, all those things are well taken care of. So those things should be on standby in all our facilities. The question is, are they?
Are they? But beyond that, are we at this stage still trying to get medical practitioners, healthcare workers, to understand Lassa fever after 50 years? Are people still having to be groomed into this Lassa fever care?
No. The same Lassa fever is a viral hemorrhagic fever, and same with Ebola. Okay, and we're not grooming people to understand it, but they must have what to work with. I would say that whether or not Lassa there's an outbreak, there should be standard precautions, standard levels. Everywhere should have a standard level. When Ebola was there, everybody had water taps, had disinfectants along the corridors before entry. We were careful when they opened doors and things like that. And then when it goes down, we all slow down. Can it be a practice? Can it be a practice where eventually we're getting to the stage where these things are seen as regular, our methods of preventing infections? It means that it's possible somebody in the community is infected, but if the person steps into the health facility, it does not spread from beyond that person. And you are able to then detect easily and treat. So at the supplies there, you know, the detection centers, there are about 4 or 5. Look at our population. What about the expertise of detection? You know, so it's not, you need that expertise. And then the drugs, making sure that it's spread around everybody who needs it. So I don't think so, although the gold standard is still a vaccination. Yes. It's still a vaccination. Because when that way you will then be protecting the host. And when you're able to protect the host, then it doesn't spread too much what is happening in the environment.
And if it does spread, then they have the immunity to handle the case.
So the vaccine is probably, while doing all, we should still strive for that vaccine.
Okay.
And it's
Let's take a quick break. We'll come back and continue this. Please stay with us, and we'll be back after now.
The Channels 24 app means you'll always be in touch with the news. Get the latest local and international stories on the go. And there's our social media platforms for news from around the world. Watch the news live and play videos that matter to you. You can also check the eyewitness section to report events around you. Just click on the eyewitness icon and follow the instructions to upload your content. Channels 24 app, the news at your fingertips.
Welcome back. You can get us on 0808 054 2233. That is 0808 054 2233 if you have any questions on Lassa fever. You can also tweet at CTV_Mary A for your questions. Now, there was this huge meeting, to commemorate the 50th year after the discovery of Lassa fever. And I'm wondering what was new about Lassa fever in that meeting. What are we looking forward to that wasn't there before, perhaps?
I think it's commendable that that was done. So 50 years after, where are we? It brought the people who were experts, brought different walks of life. So at that meeting, which I wasn't there, by the way, they brought minds from different walks of life. And at least some things came out of that meeting. And things, for instance, to say, are we dealing with the same virus, or is there some mutation here? Why are we having spikes? Because if you look at the graph over the years, which I managed to look at 2004, 2005, 2006, by the time we got to 2018, we saw the spike. And in 2019, that spike is still there, about the same months, January to March. So those were the questions that were being looked at. Are we still dealing with the same virus? And I think largely what was agreed was that we're still dealing with that virus.
Not a mutated one.
Largely that was what was accepted at that meeting. And then looked at what do we have as resources? What are the centers? Where are the centers for treatment? Where are the centers for diagnosis? How can we do better? And also looking at that meeting, it came out as well, and that's why I mentioned that it's still the rodent to human transmission. And I think it's important we're able to say that. So we're now looking at behavioral factors, because the science is there, and the science may take care of that vaccine, and it is, but it will take some time. It's really complex to get a vaccine.
That's correct.
Plus, where the vaccines are coming from, it's not a burden. It's a burden for us, and so we must, latch onto that research area and do much more. But I think a vaccine is on the way. But for us here, is still to talk about community hygiene. We're even in Lagos State. You drive around and you see heaps of garbage, all across the road, and it's an epidemic waiting to happen. It's an epidemic waiting to happen.
And it's not just Lassa fever.
It's not just Lassa fever. It's cholera, it's typhoid, it's any other kinds of disease. But, so we're now looking at behavioral factors. How do people manage their waste, for instance? If you put your waste out, you may not be able to control taking your waste in your bin to the central place, but you can control covering that bin.
When it's in your jurisdiction,
yes,
right?
You can control having a central point to pour your bin. You can put a metal cover on it to ensure that rats are not able to. You can control the fact that there are no holes in the bin. You can control the fact that you don't throw things here and there. You can control your food safety. What I mean by that is you can control not spreading
Let me
food.
hold you a little there
to
get this phone call. Hello. What's your question?
Afternoon,
Good afternoon. Please, what's your question?
I'm from Makodi.
Okay. Welcome from Makodi.
Yes. You know that I was born in 1977. We have been eating last. And there was no case like Lassa fever. And anytime Lassa fever or Ebola something died, Lassa fever happened, people think that it's in Makodi people are dying for Lassa fever. Why is it that it's not other places? Even yesterday, I'm in Constitution local government, I eat lot. Today, I'm here. There's no Lassa fever.
Okay.
This is how people catch lot. We burn it. After burning it, they cook it, we eat it. Nothing has been happening. So
Thank you.
I don't think that the medical, they should take a proper research so that they will know exactly what is causing Lassa fever.
Okay, thank you very much. Thank you very much. Now he has raised the concern. In fact, he's trying to say he's not so sure it's a rat that is causing Lassa fever. But then, I think part of the problem is what kind of rats are they eating?
Exactly. So maybe because we're not wanting to go scientific, there's a particular type of rat, okay, and it's a multi-mammate rat, okay, and I mean, you're not going to be checking rats and
Definitely
saying that,
not.
is this a Natomosis netilensis, is it this type? No, that's not yours to do. However, there are other kinds of rats. There are the bigger ones, the bush rats, and so on and so forth. But generally, we discourage eating rats.
Just because it could be dangerous,
yes,
you might not know.
Yes, because from the rats, there are 2-3 ways. One is that it defecates or urinates on food items, and that's where I was talking about spreading food items outside. You know, so it could do that on your food item. It's also possible that you eat the rat, and so because of that, it's also possible that you inhale aerosols from the body of the rat because there are feces around it.
Even that?
Yes. And you could get Lassa fever from there. So
from inhaling the aerosols?
Yes.
Now,
so please
just leave the rat alone already.
Alone. Let's focus on other types of, and so these food items that are put there, you're buying it, maybe packaged, and it all goes round to looking at all the different sectors.
So this is where NAFDAC comes into play.
Role. Okay, we've talked a lot about the cassava and gari because many times we eat gari raw, as it were, when it is soaked in water directly. So the question is, what gets to the market? Is it safe? Are there ways we can preempt and take samples of food items,
Let's take Solomon.
Yeah.
Sorry to cut you there. Let's take Solomon from Adamawa. Hello, Solomon.
Hello, good afternoon.
Good afternoon, Solomon. What's your question?
I want to make a contribution.
By all means.
The Lassa fever, it's here. It originated from Adamawa here.
Okay.
But then the impression behind it is not what we are seeing here.
How so?
Most people thought it is the rat that is the main cause of the Lassa fever. But obviously, when the incident happened, the first woman that died of the disease is a white woman.
Okay.
She came all the way from her country to Nigeria with this disease.
Okay.
So unfortunately, people thought it was as a result of the rats that were being eaten along the Lassa and Michika local government that is the cause. So I want people to get the impression that Lassa fever is not mainly caused by eating of rats. Because up to today, yesterday, tomorrow, people are still eating rats, even in Michika local government, and even in other places here in Adamawa, people are eating rats and they are continuing eating rats. And there is nothing...
okay, Solomon, let's handle that. Let the doctor talk about that. Thank you. Okay. Adamawa incidentally has one case now, I think. Now, the white lady died, but she's gone. And Lassa is still here.
Gone 50 years ago.
Okay, so and Lassa is still here. So there's something to tackle right here.
So, when we talk about looking at behavioral factors, they're all linked to cultural factors and myths and so on and so forth. So, and that's why, when we want to deal with such causes, we must really go down, speak with people, hear their thoughts, and then understand,
why they think the way they do
what
think.
you do, or you think the way you think, or you act the way you act. If we do not, then we may as well just be speaking and just speaking and just speaking without getting the results. Again, it's not all rats. I can't imagine how many species of rats that we have in Nigeria or in West Africa. However, it's a particular type of rat. And we have said, please stay hygienic, watch what you eat.
Cover your food.
Cover your food, etiquettes, normal etiquettes, and present early. And at the facility, let's do our best in ensuring that cases do not become deaths.
If a case of Lassa fever, very first case, comes in time to the hospital, can we prevent this outbreak?
Once there is one case, it's an epidemic.
Wow.
And that's why if you look at the number of contacts, I don't know how many we are, that they're trying to trace.
Okay.
Because
so we have a whole slew of people that we have to look at
so
once we see
that one person has come, has it. Who are the people living with the, who are those
We've
working?
got to close the meeting now.
Okay.
Thank you so much for coming. It's been very interesting. Thank you so much for being there with us. And please, if you don't remember anything, please remember, be hygienic about yourself and your surroundings. Enjoy the rest of your day. I am Mary Alale Yusuf.